Human Metapneumovirus, or HMPV, is a respiratory virus that impacts millions of people globally every year. Surprisingly, despite being so common, most people are unaware of its existence. This virus primarily targets the respiratory system, causing infections that range from mild cold-like symptoms to severe illnesses like pneumonia. While anyone can contract HMPV, its effects are most severe in young children, older adults, and those with compromised immune systems. It was first identified in 2001, but studies suggest that it has been affecting humans for decades. In this video, we'll dive deep into the details of HMPV, understanding what it is, how it spreads, the symptoms it causes, and ways to prevent and manage it. The goal is to create awareness about this often overlooked virus so that we can take proactive measures to protect ourselves and our loved ones. Whether you're a parent, caregiver, or just curious about health, this information is crucial. By the end of this video, you'll know everything you need to stay informed and safe. Let's begin. HMPV stands for Human Metapneumovirus, a pathogen that belongs to the paramyxovirus family. This is the same family as the viruses that cause measles, mumps, and respiratory syncytial virus, RSV. It specifically attacks the upper and lower respiratory tract, making it difficult for the body to breathe and function properly in severe cases. This virus was first discovered in the Netherlands in 2001, but research suggests that it has been circulating among humans for nearly 50 years. HMPV infects individuals of all ages, but is particularly dangerous for infants, older adults, and people with pre-existing health conditions like asthma or chronic obstructive pulmonary disease, COPD. Although most HMPV infections are mild and resolve on their own, severe cases can lead to complications such as pneumonia or bronchiolitis. These complications are more likely to occur in people with weak immune systems. Despite being so common, HMPV is often underdiagnosed, as its symptoms mimic other respiratory illnesses like the common cold or flu. This lack of awareness can delay treatment and increase the risk of complications. HMPV symptoms can vary depending on the severity of the infection and the individual's immune system. In most cases, the virus causes mild symptoms similar to a cold, which include cough, nasal congestion, or a runny nose, fever, sore throat, fatigue, or body aches. However, in more severe cases, particularly in vulnerable populations like infants and older adults, HMPV can lead to wheezing, difficulty breathing, rapid or shallow breathing, severe coughing spells, chest pain or discomfort. In extreme cases, the virus can progress to cause complications such as pneumonia or bronchiolitis, which may require hospitalization. Infants may show additional signs like poor feeding, irritability, or lethargy. Since these symptoms are very similar to those caused by the flu, RSV, or other respiratory illnesses, it can be challenging to diagnose HMPV without laboratory tests. If anyone experiences persistent breathing difficulties, high fever, or worsening symptoms, it's crucial to seek medical attention promptly. Early intervention can prevent complications and ensure proper treatment. HMPV spreads primarily through respiratory droplets, which are released when an infected person coughs, sneezes, or talks. These droplets can travel through the air and be inhaled by others, causing them to contract the virus. Additionally, HMPV can spread through direct contact with contaminated surfaces, such as door handles, tables, or toys. If a person touches an infected surface and then touches their face, eyes, or mouth, they are at risk of infection. Close contact with an infected person, such as hugging, shaking hands, or sharing utensils, can also spread the virus. HMPV is most contagious during its active phase, which is typically when symptoms are most noticeable. Currently, there is no specific antiviral medication or vaccine for HMPV. The treatment focuses on managing symptoms and supporting the body's immune response. For mild cases, this includes getting plenty of rest, staying hydrated with fluids like water, soups, or electrolyte drinks, taking over-the-counter medications like paracetamol or ibuprofen to reduce fever and body aches. In severe cases, medical intervention may be necessary. This can include oxygen therapy, the use of nebulizers to ease breathing, or even ventilator support in critical conditions. Doctors may also monitor patients for complications like pneumonia or secondary bacterial infections, which may require antibiotics. However, these treatments address complications, not the virus itself. The absence of a specific treatment makes prevention even more important. By reducing the risk of infection, you can avoid the need for medical treatment altogether. Preventing HMPV infection involves following simple but effective hygiene practices. Wash your hands frequently with soap and water for at least 20 seconds. Use alcohol-based hand sanitizers when soap isn't available. Avoid close contact with people showing symptoms of respiratory illnesses. Disinfect commonly touched surfaces, especially in shared spaces. Cover your mouth and nose with a tissue or your elbow when coughing or sneezing. Wear a mask in crowded places during peak seasons of respiratory infections. Keep children's toys, bottles, and pacifiers clean and sanitized. Parents should be particularly vigilant in protecting infants as they are most vulnerable to HMPV. Simple steps like avoiding crowded places during outbreaks or ensuring good ventilation in indoor spaces can significantly reduce the risk of infection. Prevention not only helps protect you, but also minimizes the spread of the virus to others. HMPV may not be as well known as the flu or RSV, but it's just as important to be aware of. By understanding the virus, recognizing its symptoms, and taking preventive measures, we can protect ourselves and those around us. Stay informed, stay safe, and always prioritize your health.